Hi, I'm just getting back from doing a deep dive into the data presented at the CTAD 2025. That's the Clinical Trials on Alzheimer's Disease Conference, and I have to tell you, I am cautiously optimistic about what I learned. But before we get into it, let me be completely clear. Remember, I'm not a doctor. I'm not a researcher. I'm a caregiver. I'm a Leqembi study partner for my mom, and I'm someone who's been paying very close attention to the Alzheimer's research pipeline because our family's future depends on it. So today, I'm breaking down 7 promising treatments that could be available or close to available in 2026. So we'll talk about what these medications target, where they are in the approval process, and what that means for families like ours. If you're currently navigating treatment decisions, considering clinical trials, or just trying to stay informed about what's next, this episode is for you. Because here's what I've learned through the years. The more we know, the better decisions we can make. Knowledge is power, and information is hope. So let's dive in. Before we talk about what's coming, let's acknowledge where we are right now. As of December 2025, we have 2 FDA-approved amyloid-clearing therapies. They are 1, Leqembi, or Lecanemab. That was approved in January of 2023 and fully approved in July of 2023. My mom is on Leqembi. We've been on this journey together for years now, and I've seen firsthand what it can do and what it can't do. Kisunla, or donanemab, was approved in July of 2024. This one's newer, and some families are choosing it simply because its dosing schedule and the potential to stop treatment after a specific period of time. Both of these drugs target amyloid plaques in the brain. They've been shown to slow cognitive decline in early Alzheimer's. They're not cures. They come with risk like ARIA. That's an amyloid-related imaging abnormality, brain swelling, brain bleeding. They require monthly or bi-monthly infusions, constant monitoring, MRIs, and blood work, and they only work for people in the early stages of the disease. So the question everyone's asking is, what's next? Some people phrase it, are we stuck with these 2 options? Are there other approaches being studied? What about people who can't tolerate these drugs? And what about people who are too advanced for them to work? So that's where CTAD 2025 data comes in. And here's what I've learned. We're moving beyond just amyloid. For years, decades really, the Alzheimer's research community was laser focused on amyloid plaques. The theory was pretty simple. If we clear the plaques, we stop the disease. And that focus blessed us with Leqembi and Kisunla. So it worked. But it's become clear that amyloid is not the whole story. Alzheimer's is more complex than we originally thought. It involves tau tangles. Those are the other proteins that build up in the brain, and they correlate even more closely with cognitive decline than amyloid does. Neuroinflammation is the brain's immune response going haywire and causing damage. Synaptic dysfunction are the connections between neurons breaking down, which is what actually causes the symptoms. Lastly, we have metabolic problems, when the brain has the inability to use glucose properly, basically starving their neurons of energy. So the treatments in develop for 2026 reflect this new, more sophisticated understanding. They're targeting tau tangles, inflammation, synaptic function, neuroprotection, and combination therapies to attack multiple targets at once. This diversification matters enormously. It means more options for more patients and potentially much better outcomes. So let's talk about what's actually in the pipeline. Here are 7 promising treatments that could be available or very close to being available in 2026. First up, Remternetug from Eli Lilly. What it targets are tau tangles. Here's the thing about tau. When amyloid plaques show up first in the disease process, tau tangles correlate more closely with cognitive decline. The more tau spreads through your brain, the worse your symptoms get. That's memory loss, confusion, difficulty with daily tasks. Remternetug is an antibody that targets tau and tries to stop it from spreading one neuron to another. Where is it? Right now, it's in phase 3 trials. They're ongoing, and Eli Lilly could submit for FDA approval as late as 2025, in a few weeks, or in 2026. What caregivers need to know is that if approved, this could be used in combination with Leqembi or Kisunla, hitting both amyloid and tau at the same time. That's a 1-2 punch approach that could be significantly more effective than either drug alone. Next is ALZ-801 from a company called Alzheimer. What it targets are the amyloid oligomers. That's the toxic form of amyloid before it clumps into plaques. And here's why this is exciting. It's an oral medication. It's a pill, not an infusion. So if you've ever been through monthly infusions like we have, you know what a burden that is. You know the scheduling, the time, the hours sitting in an infusion center, the IV placement, the monitoring for ARIA, the disruption of your entire day. An oral medication would be absolutely life-changing for accessibility. ALZ-801 focuses on preventing amyloid from clumping in the first place, rather than clearing the plaques that are already there. It's a prevention approach rather than a cleanup approach. Where is it? Phase 3 trials right now. Results are expected in mid-2026. What caregivers need to know: CTAD data showed it was well tolerated with minimal ARIA risk. If it works, this could be much, much easier treatment than what we have now. Masitinib from AB Science. What it targets is the neuroinflammation. Specifically, it targets mast cells in the brain. This is a completely different approach from what we've had. The theory is you can slow the neurodegeneration process itself. You're not just clearing proteins, you're addressing inflammatory damage that's killing neurons. Where is it? It's in phase 3 trial. What caregivers need to know is the CTAD 2025 showed modest but consistent cognitive benefits in patients with mild to moderate Alzheimer's. It's also oral, which is a huge advantage, and the side effect profile looked manageable. Nothing like ARIA risk we've seen with amyloid clearing therapies. Fourth, Fosgonimeton from Comentus. What it targets is synaptic function. These are the connections between the neurons. This one really caught my attention. Instead of just clearing proteins or reducing inflammation, Fosgonimeton aims to restore brain function by improving the health of the synapses, those individual connections that allow neurons to communicate. Think of it as repairing the wiring, not just removing the debris. Where is it? Right now it's in phase 2 trials, so the expected timeline is 2026 to 2027. What caregivers need to know is the early data presented at CTAD shows improvement in cognitive test and daily function. And that's a game changer for patients who've already lost significant function, because it's not just about slowing decline, it's potentially about restoring some of what's been lost. Fifth, Gantenerumab from Roche. It targets amyloid plaques like Leqembi and Kisunla. And here's the interesting part of this story. Originally, it failed its phase 3 trials, and that was just a couple of years ago. The drug didn't work at the doses they were testing, but at CTAD 2025, Roche presented new analysis showing that higher doses given early in the disease might actually work. So where is it? Roche is deciding whether to pursue regulatory approval, so they might have approval in 2026. What caregivers need to know, this highlights an absolutely critical lesson. Dosing and timing matter enormously in Alzheimer's treatment. It's not just about whether a drug works, it's about how much you give and when you give it to whom. Sixth is Semaglutide from Novo Nordisk. Yes, this is Ozempic and Wegovy. They are the diabetes and weight loss drugs that everybody's been talking about. What it targets is the metabolic pathways and inflammation in the brain. Emerging research suggests that GLP-1 receptor agonists, that's the class of drugs Ozempic belongs to, may have significant neuroprotective effects. CTAD 2025 included preliminary data suggesting cognitive benefits in at-risk populations. And where is it? Well, it's in phase 3 trials. The EVOKE study is expected to release results in early 2026. What caregivers need to know, if proven effective, this could be a relatively fast path to approval because the drug is already FDA approved for other uses. We know it's safe, we know its side effect profile, it's injectable, but it's weekly, not monthly like Leqembi infusions are. And honestly, a lot of people are already on semaglutide for diabetes or weight loss. If it also protects the brain, that's an enormous win. And finally, number 7, combination therapy trials and what they target. They target multiple pathways simultaneously. Several studies presented at CTAD 2025 are testing combinations of treatments. Those combinations are amyloid clearing plus tau therapy, amyloid clearing plus anti-inflammatory, with multiple mechanisms at once. Just like cancer treatment evolved from single drugs to sophisticated cocktails that attack tumors from multiple angles, Alzheimer's treatment may require the same approach. Where are they? Well, there's multiples. So we have some in phase 2 and some in phase 3 trials, with results coming out in 2026 and beyond. What caregivers need to know, if your loved one is already on Leqembi or Kisunla, watch for these trials to combine it with other therapies. This very well could be the future of Alzheimer's treatment. Now, one of the most exciting discussions at CTAD 2025 wasn't about a specific drug, it was about when to treat. Researchers are increasingly focused on preclinical and prodromal Alzheimer's. This is treating people before they have significant symptoms. Several studies presented data on treating patients with biomarker evidence of Alzheimer's, but no symptoms yet. If you have a family history of Alzheimer's, like I do, with 3 generations affected, if you carry genetic risk factors like ApoE4, Biomarker testing and early intervention may become realistic options in 2026. We're talking about amyloid PET scans that can detect plaques years before symptoms appear, and the tau PET scans that show where tau is spreading in the brain. We also have new blood-based biomarker tests, which are now available commercially and are so much easier than a PET scan. We have ApoE4 genetic testing to understand your risk level. The earlier you catch it, the more treatment options you have, the more time you have to slow it down, and the more years you can preserve. That's a fundamental shift on how we think about this disease. Okay, so now I've given you a lot of really good, hopeful information. There are a lot of exciting possibilities, but I still need to be completely honest about what this development means and what they don't mean. The good news, more options are coming. Different mechanisms mean more patients may benefit. Not everyone responds to amyloid clearing therapy, so these alternatives matter. Oral medications are in development. Pills are so much easier than infusions, and combination therapies may be significantly more effective. The cautions and the things that we need to keep an open mind about are in development does not mean approved. We've seen this happen many times before. Many promising drugs still fail in phase 3 trials. Even approved drugs face insurance hurdles with prior authorization nightmares and availability issues. These are still not cures, and let me be absolutely clear, we're talking about slowing decline, not reversing it, and not stopping it completely. Early stage disease remains the focus. Most of these treatments treat mild to moderate Alzheimer's. If you're already advanced, options are still limited. So yes, be hopeful. I am certainly very hopeful, but also be realistic. Be informed. Be prepared for the long fight ahead. So what should you do right now if you're caring for someone with Alzheimer's or worried about your own risk? Here's my advice. First, stay informed about current treatments. If your loved one has early-stage Alzheimer's and isn't on Leqembi or Kisunla, talk to their neurologist this week. These treatments are available right now, and waiting means losing precious time. Many of the therapies I talked about today are actively recruiting patients. You can visit the clinicaltrials.gov website and search for Alzheimer's trials in your area, or use the Alzheimer's Association Trial Match program to get matched with appropriate studies. Ask about biomarker testing. If you have a family history or genetic risk, talk to your doctor about the following. You do have options to have an amyloid PET scan, a tau PET scan, a blood-based biomarker test, ApoE4 genetic testing. Early detection creates more treatment options, period. Stay connected to research centers. Academic medical centers and research hospitals often have access to clinical trials before community practices do. If you're not already connected to one, consider getting a second opinion or consultation at a research center like we did at Kirwan Medical Center. Join advocacy groups. Organizations like Us Against Alzheimer's, the Alzheimer's Association, and patient advocacy networks keep you updated on treatment developments and policy changes. And honestly, they're fighting for access, for insurance coverage, for faster FDA approvals. We need to be a part of that fight. Here's what I want you to take away from this episode. 2026 could bring the following: new oral medications that don't require infusions, tau targeting therapies that address a different protein, anti-inflammatory approaches that protect neurons, and treatments that restore function, not just slow decline, early intervention strategies that catch disease before symptoms appear. But we're not there yet. Clinical trials still need to be complete. FDA approvals take time. Access and insurance coverage remain enormous challenges. What you can do right now is maximize your current treatment options. Consider clinical trial participation. Get biomarker testing if you're at risk. Stay informed about the pipeline. Advocate loudly for better access and coverage. Lastly, don't forget about Dr. Dale Bredesen's protocols. You can go on Amazon and buy his books today and learn about the lifestyle changes, dietary changes, and exercise that you can do to help with anyone experiencing memory loss. The future of Alzheimer's treatment is brighter than it has ever been, but we still need to fight for every day, every treatment, and every advancement. When my grandmother was diagnosed in the mid-90s, we had absolutely nothing. Nothing. When my mom was diagnosed in 2018, we had hope, but no approved treatments. Today, in December 2025, we have Leqembi. Mom is stable. She's present. She's still here. She is living her best life right now. In 2026, we may have even more options. Is it enough? No. Is it fast enough? No. But it's movement in the right direction, and that matters. If you're navigating Alzheimer's treatment decisions, or if you're considering clinical trial participation, I can help with that. At Memory Treatment Advisors, I work with families one-on-one to understand the available options, to weigh the benefits and risk, and make informed decisions about treatment. You can book a free 10-minute clarity call at memorytreatmentadvisors.com. Just push on the schedule button or send me a text. You can reach me by text at 214-924-6102. Thank you for listening to this episode. If it helped you, please share it with another caregiver who needs to hear it. Leave a review, subscribe so you don't miss any future episodes, like it, push all the buttons. Thank you for listening to this episode. If it helped you, please share it with another caregiver who needs to hear it. Leave a review, subscribe so you don't miss any future episodes, like it, push all the buttons. You can find show notes and links to all the resources that I mentioned and a full transcript below. And remember, we do all of this with clarity, courage, and care. I'm Terry. Until next time, take good care of yourself. And if you're fighting this fight, you're not alone. I see you, and I'm right there with you.